Good evening. This is me, Sharveen, live from SMKBP studio. Coming up for you, Sabah could unleash tsunami of COVID-19 cases. Health experts have expressed concern over the COVID-19 situation in Sabah, which they say has the potential to unleash a tsunami of cases if urgent measures are not put in place. They fear the emergence of new cases and clusters in Sabah meant the state was going down the path of the Philippines or Indonesia in terms of the infection rate. Malaysian Public Health Physicians Association President Dr. Zainal Arifin Omar said Sabah was no longer a ticking time bomb waiting to explode, but a chain of hidden time bombs that have exploded, with new clusters being detected by the Health Ministry. Based on news reports, COVID-19 is already within the community in Sabah, infecting the public as well as health workers. Several elements in Sabah contributed to the rise in cases and the emergence of new clusters, such as the presence of large groups of undocumented immigrants and foreigners. Also key is the state election, which has led to major mobilization of election machinery and public interaction, including people coming in from outside the state. In terms of the number of cases, Sabah has become a mini version of the Philippines and Indonesia. The state has the potential to unleash a COVID-19 tsunami. Fortunately, there is an excellent healthcare system and health resources and support at the state level and from the federal government, said Dr. Zainal. He was commenting on the surge in new cases following the emergence of a 7th COVID-19 cluster in Sabah. Yesterday, Health Director General Tan Sri Dr. Nur Hisham Abdullah announced that a new cluster has been detected in Sampurna, dubbed the Banga cluster, with 5 cases. On Monday, Dr. Nur Hisham announced that the ministry had detected the quarters cluster involving a health worker and the worker's close contacts in Tonggak, Sandakan. University Putra Malaysia Epidemiology and Biostatistics expert, Associate Professor Dr. Malina Osman, said the Sabah election might have contributed to the surge in COVID-19 cases. She said the fact that the state was currently managed by a caretaker government might mean that public interest in the election was being prioritized over the managing of the pandemic. Management of the outbreak may not be in full swing. We know that management of the outbreak at higher levels require undivided cohesive cooperation from all stakeholders and agencies. Dr. Zainal said he hoped the government would implement stricter measures to prevent the situation from escalating. A postponement of the polls is ideal but unlikely unless a state of emergency or high-level health emergency is declared. It is a catch-22 situation and a very difficult political decision. Having said that, I want to express my sympathy and support for ministry staff, members of the police, armed forces, People's Volunteer Corps, and Election Commission who are on the ground monitoring the situation. He said it was important for all parties to comply with standard operating procedures under the Recovery Movement Control Order to mitigate the risk of the virus transmission in the community. From a public health aspect, it is imperative for the Ministry and National Security Council to urgently increase health facilities and capabilities to face a possible increase in cases. Dr. Malina urged the government to consider implementing the targeted enhanced movement control order as soon as possible in affected areas. This will allow intensive screenings to find those who may have been infected and prevent further spread in the community. Local community leaders or organizations must continue voluntary efforts to prevent the spread of infection. In situations like Sabah's, the public cannot afford to wait for decisions from the upper levels. Every individual should come forward to protect and help each other. For more news anytime, visit studio.smkbp.com.my. Thank you.